This video is from the Brain and Spine Surgery Consortium incorporating Spine Fixed in Abuja and Port Harcourt, showing our first quarter results for the year 2018. 19 operations were performed on 19 clients with no repeat procedures. There were 16 spine operations and 3 brain operations. For the 16 spine operations, 10 lumbar pedicle screw fixations in all, a lumbar microdiscectomy, removal of infected pedicle screws, 1 abandoned spinal fixation for tumor, 2 thoracic and 1 cervical myelopathy cases for decompression and fixation. For the 16 spine surgeries, there was 1 case for additional screw fixation and 1 infected case from a patient who had gone on medical tourism to Dubai. There were also 4 cases of spinal tumors. For the 3 brain surgeries, there was a colloid cyst, a cerebellar cyst, and a brain metastasis. Of the brain operations, transcolossal approach for colloid cyst was employed with a posterior fossa craniotomy for cerebellar cyst and an occipital craniotomy for breast met to the brain. In all, for the 19 operations, 2 clients had special complications during their operations. The 2 special complications were handled with surgery abandoned due to excessive bleeding in the 2 cases with tumor metastasis. For the brain and spine cases, 1 was for a patient with breast cancer and the other with multiple myeloma. For a case with bleeding complications, there was brain tumor residual left in 1 case and the operation was abandoned in the other, so no spinal fixation was performed. The lives were saved in both cases as the patients survived the operation. For 19 operations, there was no case of surgical site wound infection. For 19 operations performed, 3 clients died. For the 3 clients that died, 1 was a patient with brain tumor metastasis and died of respiratory failure. 2 others died of aspiration, 1 at home after discharge and another days after uncomplicated recovery from lumbar spine surgery. In both cases, the patients were being fed by relatives. Now, for the summary, in 19 clients, we had 16 with good outcomes, 2 complications, and 3 deaths. The overall outcome is that there was a good outcome in the majority of cases with spine diseases. 2 of the 3 cases with brain disease had excellent recovery. Our conclusions and the lessons learned from this summary is: there is a need for better management of bleeding from tumor metastasis. There is also need to closely monitor feeding in the hospital to prevent aspirations. We also need to put things in place to prevent further mortality. We need to sustain the good outcomes from the first quarter. We do brain and spine surgery. Why would anyone go abroad?